Now? Okay. First, I would like to thank Mr. Peterson and wish Mr. Giffens all the success in his new position. Mr. President, dear members of the Security Council, reports and analysis presented to the Security Council on situation in Syria are a lot, but only a few of those come from local organizations working on the ground. For that, and on behalf of the Syrian Red Crescent, I'm therefore grateful for the opportunity to share our experience as a foremost first-line responder to the worsening humanitarian situation in the country. In the northeast of Syria, the water crisis is yet another crisis that people have to cope with. More than 1.1 million people are without drinking water because of the lack of the power to operate a local water station sometimes, and the lack of the political will some other times. Many times we asked to neutralize this water station so our teams and local water engineers can have unhindered access to maintain and operate the station. But still the lifeline of millions of people is used as a bargaining chip between the parties. In addition to that, the water level in Al-Furat level has gone down with less and less water coming from Turkey. And with the hot summer weather, the area is now suffering from severe drought. Even the few pumps we managed to install alongside the banks of the river don't reach the water now, since the water level had declined more than 10 meters. SARC, ICRC, and UNICEF are working day and night to fill water tanks in cities and truck water from the few resources available, but we are merely scratching the surface of the problem, and there is need for a more sustainable solution. In Dar'a, our teams are responding to the population movement that continue to happen due to the ongoing hostilities that's happening lately. Our teams manned the humanitarian corridor that we managed to secure to exit more than 38,000 people to safety, mostly women and children. We have opened six shelters to house some 1,449 people, while the rest took shelters with relatives and friends in the surrounding area. We also managed to provide first aid to 406 cases and med-evac 9 cases to hospital in Damascus. Medical supplies were also delivered to the National Hospital by WHO and ICRC on the 3rd and on the 13th of August. Currently, we are preparing for a humanitarian convoy to Dar'a with food and other essential materials useful for the people who remained in their houses. This is an interagency convoy with SARC, ICRC, UN, and the Red Cross Red Crescent movement partners, which has been green-lighted from the Syrian government. As for Dar'a al-Balad, the area that is in the eye of the conflict, in which we lastly distributed aid on the 16th of July, we are still monitoring the situation closely from the safety and security perspective, and we will enter the area to deliver the needed aid when the situation permits. As a humanitarian organization, we always aim to fulfill our mandate by reaching the people in need everywhere. From March 2020, we have secured the needed approval to carry on an interagency crossline convoy to Atare, near Idlib. But until now, over a year later, there are still no guarantees to go ahead with this convoy. We also facilitated the approval for WFP to pre-position aid material crossline to Sarmada, and this also did not happen yet. The Security Council agreed on decision 2585 a few months ago, which called for the crossline access in addition to the cross-border access. The decision also said about all modalities possible should be used to reach the people in need. But I'm sorry to report to you that the crossline part of this decision did not happen yet, until today. Our President, Mr.Hboubati, always asks about the reason why crossline missions are not happening. And in my turn, I pass this question to the UN. Hopefully they are in a better position to provide an answer to us and to this Council. In the south area near At-Tanf, we are trying to resume our humanitarian intervention by helping the people living in Rukban camp to go back to their original places of living. Until now, we facilitated the voluntary exit of more than 20,000 people without any problem. but there is still around 10 to 12,000 people inside the camp, and the assessment we carried out with OCHA last year indicate that some of them are still wanting to leave. Our team and the UN team stand on the 55-kilometer point, ready to facilitate their exit to areas of their choice all around Syria. The psychoeconomic hardship is taking a toll on the people of Syria. Food prices have gone through the roof. The price of standard food basket has increased nearly 200% in the last year. A food parcel provided by ICRC or WFP and distributed by our volunteers is now worth a fortune. And we continuously monitor the prices of the black market, and they are increasing a lot. And before you ask, yes, there is beneficiaries who sell or exchange some of their food for other commodities, and that is a fact of life. Not because they don't need it, but because there are more urgent priorities than food, such as medicine, shelter, or even water, which they sometimes have to buy because the water supply is not adequate, or there is no ability to pump the water if the supply exists. Many health services are at risk. Life-saving support for our dialysis centers are now at risk of being stopped because we cannot find the filters or the materials to maintain this service. Even our partners in the WHO are facing some challenges obtaining those filters. Now we only have materials until the end of this coming September, and we have started to ask our patients to try and find some other service providers. This is a critical life-saving service that will stop within a month, and still there is no solution in the horizon. I can go on listing the challenges the challenge the people in Syria are facing, which the humanitarian actors, including the UN agencies and the NGOs, are trying to solve, but our job is not getting easier. The sanctions and the restrictive measures are yet another factor adding to the suffering of people and the humanitarian organizations. Those measures are making it so much harder for the millions of men, women, and children to get back on their feet with dignity. I addressed the Security Council 9 months ago, and since then it has become even more evident that the consequences of the sanctions to the common people, and for that matter all the humanitarian organizations in Syria, exceed any political objectives. There is a need to recognize the unintended consequences of the punitive measures to the population already under the decades of violence and instability. During the preparation of this briefing, I came across tens of reports and analysis prepared by other humanitarian organizations working in Syria. Some organizations have demanded to redefine the term humanitarian work, so their activities do not get red flagged. This is also to convince donors to fund humanitarian rehabilitation, because they cannot continue to give people water in bottles or jerry cans, while the simplest logic dictates that they should maintain the water lines, so people can drink on their own, or they can grow their own food instead of eating from a box or even a can. Send children to schools instead of just reading how schools are good and children should be sent to schools when they exist. Mr. President, we are tired. The humanitarian organizations are exhausted and frustrated with the idea that declaring sanctions and restrictive measures on the whole population is a tool to change towards a better future. With the attempts to hinder efforts to normalize the lives of people who are returning to their destructed cities, and they are just trying to build up a new life with the little they have left. Please stop prioritizing the political games over ending the suffering of fellow humans, and let us all work together towards fulfilling humanitarian pledges made: more access, more support, and less generalized sanctions and restrictive measures, so Syrians can live and rebuild their lives with dignity. I thank you all.